Hello, everyone. This is Rafi. I'm here with Dr. Mikael Sodergren. I'm pleased to talk to him today about cannabis and a whole host of topics related to it. So welcome, Michael.
Thank you very much, Rafi. Thanks for the invitation to talk to you today.
Yeah, it's my pleasure. I came across your work on Twitter, which is where I get most of my news and most of my medical scientific news these days. There was a study about the Entourage Effect, which maybe you can start off by telling us what it is and what it has to do with cannabis, and then we can maybe get into how you came to study cannabis, which is not which maybe not enough people do, I would say.
Yeah, no, absolutely. So, I mean, I can start with that. So I'm an academic clinician. I'm a surgeon by training, but I began studying medical cannabis some years ago, essentially evaluating cancer biology and the effects of CBD, which is one of the main cannabinoids in the plant, and the effects of CBD in the treatment of pancreatic cancer in cell lines and mouse models that we have, and particularly how it interacts with the common cytotoxics, the common chemotherapies that we use, because it appears to have some additional effect that we're yet to fully delineate. So that's where my interests in this started. We've expanded on that research program at Imperial, where I now lead a research group where we have PhD students, postdoc fellow, and where the indications have expanded beyond cancer biology. We're also focusing very much on pain research, and that's the research that you came across on Twitter, I think, which is a peer-reviewed paper, a peer-reviewed a journal paper where we were reviewing the this entourage effect, which is something peculiar to but it's sorry, not particular to cannabis, but it is something that's very often spoken about with cannabis, and it's really that in the plant, you have a number of different active ingredients, as it were. We have over 120 cannabinoids. You know, the two that are most well known are THC and CBD. About 120 others. Then you have compounds called terpenes and many other things. And this phenomenon, the entourage effect, is a description of the fact that when you add some of these together, they seem to have a more pronounced effect on what you're aiming to treat than when they're used on their own. And so that's different to synergy, where synergy, if I use the example of pain, if you have two painkillers that are both painkillers, but together they work better than each one alone, that's called a synergy. Entourage effect is where you have one painkiller, for instance, CBD in the cannabis plant, but then you have an inactive compound that doesn't have an effect on pain, but when they're added together, the analgesic properties, the painkilling properties of CBD are enhanced. And so we found that phenomenon really exciting to explore. Obviously, for drug development, for therapies, it's really important to understand it. And so this paper that we published recently is the first part of that, trying to set the landscape, trying to understand what the preclinical data is that's available in the literature, whether that's in vitro in a petri dish or in vivo in some animal studies, and really seeing how best to investigate this phenomenon. And what I mean by that is what experimental platforms, what models, cell lines, et cetera, how best to do that to really try to untangle this answer as to, does this entourage effect really exist? And if it does, can we understand it so that we can take advantage of that understanding in developing the painkillers of the future?
So one of the first things that jumps to my mind is when it comes to pain, we often hear that sometimes it works, sometimes it doesn't. Maybe it has to do with neuropathic pain, maybe it has to do with inflammation. There are different ideas around that. Do you think it also may have to do with the form in which the cannabinoids or the whole plant is delivered, meaning how much of the therapeutic effect can you attribute to THC versus a whole plant extract where you might have 120 active compounds? When it comes to pain, maybe in the most common use case for cannabis, if there is such a case, do you think it's still mostly down to THC as far as we know, or is this really open and could it be really open-ended?
No, I mean we've got very compelling preclinical data that we published as well at the end of last year that shows using dorsal root ganglion neurons of rats, where we've shown that we can measure the excitation when you co-culture these neurons with therapies such as cannabidiol. We can measure essentially how they fire off, which would be a pain signal in the body. And we've got compelling evidence that shows that CBD decreases those pain signals. And so CBD is certainly an analgesic. We also know that THC is. And so what we would need to understand is that, are there synergies between those? What are the optimal proportions? What are the other constituents of the plant that are necessary to produce this whole plant response, which anecdotally we hear patients say is much more powerful than using the isolates of these medicines by themselves. And so it's really, and that's what we're working on at the moment. In vitro, we want to find out how these, first of all, we're only starting with cannabinoids, but then as I alluded to initially, there's a whole range of different compounds. How these, 3-4 top cannabinoids, when I say top, I mean that are the highest concentration in the naturally occurring plant, what proportions of those are the most beneficial, get the best results in vitro, and then also studying the signaling pathways, because we're really just scratching at the surface of how these compounds signal for pain management. We know CB1, CB2 receptors, and TRPV1 is another signaling pathway that's very well recognized. But the data that we've got shows that there are probably pathways or even receptor mechanisms that are very poorly understood that contribute to how these compounds affect the perception and pain in humans. And so there's a lot of work to be done. But it's about how we set up controlled experiments so that we can begin to untangle the effects of all of these constituents of the plant.
Yeah, and in the psychedelic studies, they have niacin as a positive control. And what is the equivalent for cannabis?
I don't think there is an equivalent for cannabis as positive controls. Particularly when it comes to pain. The interesting thing with cannabis, of course, is that we have an endocannabinoid system. All humans have that. So we have a receptor system with the CB1, CB2 receptors. We have endogenous ligands and endogenous cannabinoids, such as anandamide, that we produce that are part of that system. And so I suppose if you would think about it, you could use something like that as positive control, but we don't usually, and certainly for in vitro pain work.
Right. Yeah, I was thinking about the phenomenology of it, because so much of pain, of course, has to do with, lack for a better word, perception. Which is why, to some extent, you can distract yourself from pain through breath work or through other conflicting stimuli. There's all sorts of things around that.
Yeah, I mean, absolutely. I mean, pain is so complex, but the perception of pain, what we can do from a scientific point of view is understand, how neurons are excited by certain chemical entities. how that is perceived by a subject, is very complex and relates to the environment and all the factors that you alluded to. And of course, with pain, there are big placebo effects as well in treatments. And so it's very, very complex. But, this is the best way that we can evaluate it in the lab, obviously.
Yeah, absolutely. And so how did you come to study cannabis? Because you're a surgeon. Basically, so how did you come to that?
Very good question. And so I think it started, over many years, I've had patients who ask me, what's the role for cannabis-based medicines, particularly as analgesia post-operatively. What I do inflicts a lot of pain on patients, unfortunately. And the traditional methods that we have to solve those problems with pain are not good. Opioid analgesics have a myriad of side effects which are not very well tolerated by many patients, and particularly in what I do in surgery, the side effects of opioids are really counterproductive because they slow down recovery. They also make patients more prone to morbidity, to complications such as respiratory infections and others. And so I, like most of my colleagues, have had patients ask, following legalization of medical cannabis in other countries, is it possible for me to be able to access that as part of my post-operative analgesia? And so there was an awareness, and then our real interest began when we started doing some work around CBD. And CBD is a powerful anti-inflammatory, and how that interacts with cytotoxics, so chemotherapy agents that we use for pancreas cancer. And we have some interesting preclinical data around that, and so we got some funding to amplify that research program, and then we started looking at pain in more detail as well, through preclinical research activities that we're hopefully going to be able to translate into clinical trials in the relatively near future.
Okay. And when we mentioned pain, but are there any particular diseases where you see, let's start with CBD, where you see CBD alone potentially having a strong role? I know there's a lot of interest around Charlotte's Web and the high CBD strains of cannabis, especially for infant epilepsy. So I don't know if there's any top sort of favorite candidates for CBD alone that you can put your finger on.
Yeah, I mean, absolutely. Childhood epilepsy syndromes, medical cannabis is now standard of care as a second line. There's no question. We have very good randomized controlled data that supports the efficacy of these medicines. And so, there is an established role and that's essentially Epidiolex, which is the licensed medicine, is a CBD isolate. It's CBD on its own. And so there's an established role for that in epilepsy. We've also seen in the clinic that there is some anecdotal and some low-level evidence of efficacy for other conditions, like in particular anxiety syndromes. So that's something that needs more rigorous clinical research, but there's certainly a signal there, as well as some others. But I think that we're at the moment in the phase where, after it became legal in the UK, which is only 2.5 years ago, and in many other countries, it's medical cannabis isn't legal yet, or has just become legalized. We're in the phase of trying to build this evidence base as quickly as possible, because we just haven't before. There's been no motivation, there's been lack of funding, etc. And so I think that we're going to see high-level evidence for a number of different other indications for high CBD products over the next few years. But as I said, anecdotal in the clinic, we're seeing a really good signal for conditions like anxiety disorders.
Yeah. I tried to. So my father had some anxiety, and we tried some CBD products. I don't think he managed to consume them in sufficient amounts. I tried to find a product that had some decent bioavailability, because a lot of the common CBD products really aren't absorbed that much. So it's hard to get enough orally. So we tried to find to give him some higher CBD products, and I can't say I saw an enormous difference in some of the inflammation he had in his tear ducts. He had this chronic sinusitis and inflammation in his tear ducts. So I'm wondering where you've seen it most efficacious in that regard, with CBD and inflammation.
I think that what you touched upon is an important issue, in that the CBD is, like in the UK, is not regulated, and so you know, the wellness or high street products, we've now got really some quite good data that shows us that, you know, what's on the label is not really what you're getting in the bottle for many products, and that's obviously problematic. The other thing is that the doses of these wellness products are subtherapeutic, and so in many ways, I can understand why that is something that your father got. It may not have worked. Of course, CBD doesn't work for everyone.
Right.
What we have seen is that you know, particularly for inflammatory disorders, it is useful, and some of the interesting things that we've seen is for instance, is in inflammatory pain disorders. So, you know, those patients who've got severe symptoms from rheumatoid arthritis, for instance, we've had some in the clinic, some anecdotal, again, we don't have high level of evidence, anecdotal, really nice results. We know for sure that CBD is a powerful anti-inflammatory. We can prove that preclinically and clinically as well. It's the clinical outcomes that are sort of lagging behind a little bit. But as I said, in response to your previous question, I think we're going to see more and more of these coming online over the next few years.
Yeah, I'm pretty excited about them, to be honest. It's there's a great difficulty in treating pain properly. I see it around me all the time, and there's a lot of off-label use of various medications. Sometimes you get benzodiazepines being used for pain, strangely. I mean, there's a lot of strange things going on there. So I hope you can get something with a bigger therapeutic index, bigger therapeutic window. So maybe you want to explain what that concept is, and why it's important to get a handle, to get therapies that have these large therapeutic indices or windows.
Yeah, I mean, particularly in relation to pain, pain is interesting, of course. And one of the things that you were discussing before is, how do we know who's going to be benefiting from these therapies, essentially? And so where we're heading with medical cannabis is pretty much in the same direction as all of medicine. We're going hopefully down the route of personalized medicine, but for that we need data. And so what we're looking at now is these therapies with large therapeutic windows, whereby, for instance, with pain, now I think we have enough high level data to tell us that medical cannabis as a whole is an effective therapy for chronic pain. However, what we want to understand is all of these, you know, subclasses of pain, neuropathic, inflammatory, you know, et cetera, how best to treat these individually, and also then dig down even further at a patient level basis. And so it's how do we discover biomarkers that are able to tell us who would benefit the most from a particular therapy.
Yeah, it's hard to assess someone's sensitivity to cannabis just generally, to get the doses right when it comes to a product with a psychotropic effect. It's not easy to predict, and the route of administration is important. So when you look at clinical trials in cannabis and people are trying to get the dosing right, how do you go about figuring that out? How do you establish what a standard dose is for a perceived effect or therapeutic effect?
Yeah, it's difficult when looking at the current literature, because The trial designs are heterogeneous. The compounds that are used are also heterogeneous. The pharmacokinetics of the modes of administration are in some instances unknown. And the bioavailability of oral administration is poor as well. And so these are all problems that are related to trial will influence trial designs in medical cannabis. I think the key is to be able to advance this to a stage where we have a mode of administration that produces a consistent pharmacokinetic profile. We understand the pharmacodynamics. And when we get to that stage, and we're not there yet, but I suspect that's going to be something novel, such as an inhaled device, or maybe a plaster, something topical, something like that. When we get to that stage, then it's going to be much easier to do meaningful trials that are generalizable. And that's the problem with the trials now, that it's very difficult to amalgamate that evidence. And it's also difficult to understand the applicability of those trials beyond the population that they were tested in and the specific preparation that was used.
Right, and that reminds me of a dosing effect of CBD. Maybe you can disabuse me if it's not correct, but isn't it slightly stimulatory at a low dose and then has more of a sedative effect at a higher dose, sort of a dose we're more likely to consume, typically speaking, or did I get that wrong?
No, I think that what you're referring to is that, which is another phenomenon which we're unsure about the exact mechanisms, but it's when you have THC, when you are adding CBD to that, at low doses, it appears to decrease the psychotropic unwanted side effects of THC. We're unsure about what the mechanism behind that is, but it's certainly a phenomenon that we've observed, again, anecdotally in the clinic.
Okay, that's interesting, because I thought that the CBD had been, when administered to schizophrenics, didn't seem to decrease their symptoms of psychosis. I can't remember if it was both the positive and the negative ones. So I was wondering how well that translated.
No, I think that on the contrary, the recent clinical data that we have is that CBD is quite an effective treatment for even cannabis induced psychosis. I mean, cannabis induced psychosis is very different to what you get. We don't really see those side effects. That's something that you get from these synthetic cannabinoids that are made for recreational use. Those are not part of the medical spectrum of treatments, obviously. But yeah, the most recent data is that CBD seems to be a relatively effective method, or at least have some efficacy in treating these symptoms. Okay.
Oh, that's interesting. I was not aware of that. I'll have to read up on that. That's really good news. I was actually disappointed, thinking that it might not help in that regard. So if it's starting to show it does, that's great.
No, yeah, fantastic. Absolutely. I mean, it's really interesting and sounds counterintuitive maybe to some, but yeah, it's great.
Yeah, I was actually interested in speaking with patients either with schizophrenia or bipolar disorder who are currently cannabis consumers, and I wanted just to query them basically about their experience and why they do it, and if they think it makes things worse or if it makes things better. Because, I mean, we've all heard that it's supposed to make these diseases worse or potentially even trigger them. And I was surprised to know a few years back that actually there's a not insignificant amount of people who remain consumers even throughout the disease course. And it's interesting to hear that some people describe using it because it sort of calms the voices in their heads that can sort of distract them from them somewhat. And other people, I think, would report that it just makes everything just terrible, just worse. And I'm very, very interested in that, because I wonder if it's more a question of the patient themselves, or if it's something in the composition of the cannabis, or some ratio of cannabinoids or something.
Yeah, I mean, the key consideration there is that cannabis that most of these people consume in the illicit market is much higher doses of THC and often synthetics and completely different to what we prescribe in a medical setting.
Yeah, the degree of control is vastly different, and the legal markets have a lot of synthetic ones mixed in, which have all sorts of dosing problems and just haven't even been studied really. So yeah, it's good to caution people against that, just in case.
Absolutely.
Yeah, and is there something in particular that you're looking forward to study with your group in the near future? Do you have any current research topics?
So we're looking forward to really diving a little bit deeper into this entourage effect and understanding, especially with the main cannabinoids, how they interact with each other, and to see if there's a signal there that we can take forward to essentially the drug development process and clinical studies.
Okay, and is the potential outcome when looking at that only drug discovery, or does it also have to do with setting up strains of cannabis themselves that would be used either through vaporization or oral routes?
I suppose that's what I mean about the drug discovery. The drug development process in cannabis is different because you can have synthetics that you mix, or you can have breeding programs where you develop through breeding plants of different constituents of cannabinoids and so on. Right.
Okay. I see what you mean. That's great. And so the entourage effect, how does that compare to other drugs that we have on the market? Do other drugs come with an entourage effect, or not really?
No, most medicines that we have now has one active pharmaceutical ingredient in them. That's you understand that molecule, how it interacts with the human body, and this is obviously different because this plant has a number of different active pharmaceutical ingredients, if you will, and so this is a phenomenon that we don't see in traditional pharma.
Right. Yeah. There's no slow release degrading enzymes or things added into it, so no chance of that there. Yeah, I was wondering if you see cannabis as able to help doctors deprescribe and titrate down their doses on a variety of medications. Do you think cannabis has a role in that sense? And have you actually seen it already? Have you seen this happening in the UK or?
Yeah, 100%. So I think particularly with pain relief, and this a decrease in opioid consumption with treatment with cannabis-based products. So we're hoping to publish that data relatively soon as well. Oh,
that's really encouraging. There's a big need to get people off those pain pills. That's certainly the case. Just one or two last questions for you. How is the scientific research proceeding in the UK now that you're still in a relatively strict lockdown situation? I just wanted your review from there.
Yeah, I mean, we're lifting lockdown gradually as a week or so ago, and from a research point of view, we're hoping to recommence clinical trials that have paused, if they've not been recommenced already, in the very near future. And all of our scientists are back in the lab now. And so we're hoping that over the next few weeks, we're going to be back to some degree of normality.
Okay, good news. We need those trials to get done, as you said. They haven't been done soon enough. And I guess my last question for you is there a question or a topic that you think the mainstream mainstream medicine isn't talking about enough and should be more interested in? Is there a particular question or topic?
I think that prominent as a narrative over the next 2 years, in that we're seeing in Europe, we're lagging behind, but we're still seeing this opioid epidemic that is much more advanced in the States. But we're seeing the same phenomenon here. We're a little bit behind the curve. And really I think the narrative that we're going to be hearing more and more of is how can cannabis-based medicines be used as a tool in to solve that problem, which we need to solve. And I think that that's going to be a very hot political and research topic over the next few years.
Okay, that's good to hear. Yeah, I hope it gets some press. I've been hearing about it more in the US press, not so much in Europe. So hopefully that starts to bleed over in the best of ways.
Absolutely.
Yeah. Well, Michael, thank you so much for taking the time. I wish you the best of luck with your research, and I think what you're doing is so desperately needed. So thank you for doing the work, and I'll be keeping a close eye on it and talking about it on Twitter.
No problem. Thank you very much. Thanks for having me.
Thank you.
All the best. Bye-bye.